Hey everyone, welcome to tonight's BICP Talks with Travis. Tonight we are going to be talking about wound care. Wounds are a pretty common injury for us to come across while riding. This would be abrasions, punctures, lacerations. We'll kind of talk about how they present themselves in mountain biking. But these are some of the things that we're going to be most actively providing care for out on the trail or in our clinics. And oftentimes in a mountain bike context or in our working context, these are relatively minor injuries, provided we are managing risk effectively. So, what we're going to talk through tonight are some of the primary causes of these types of injuries, as well as first aid principles, talk about how to treat the wounds, different types of wounds specifically, and some concepts around evacuating our participants, dismissing them from the class, all that sort of stuff. So, jumping into it. Oh, and of course, if you have any questions that pop up as we go through this call, feel free to send me an email after the fact at travis@icp.bike, and I'll happily get any questions answered for you that I can. I will also, just like when we talked about our heat illnesses, I will also confirm that, hey, this talk that we're going to have tonight is not sufficient for your will or your first aid training or your first aid qualifications. So definitely seek out those certifications from, the variety of providers that do them and get some hands-on training so you can go through this stuff a little bit more in depth. But jumping in. So causes, let's talk about those and as well as the different ways that these wounds can present themselves. So punctures. Punctures is a good place for us to start because it's not necessarily something that we associate with mountain biking very frequently. The way that this is going to present itself most often is, pedal spikes to the shin or shinners, and those can be kind of like brought into lacerations as well, depending on the severity of the shin hit or shin dig, but they will start out as punctures. Uh, we can also experience punctures from a little bit more dangerous parts of the bike. So the reason why we have closed bar ends or plugs at the end of our bars is so that we can't get a puncture that way. Um, I've never had this problem in any clinic or any program or any personal riding ever. But I have heard of circumstances where rider takes a spill, is moving forward over the bike, handlebars get turned, and the handlebar, especially if they don't have a plug in the end, could puncture into their torso or into their thigh, different places like that. And that type of puncture is going to be outside of the scope of what we're talking about in this call because it's a lot less likely for us to happen or for it to happen to us. But it is something that we want to be aware of. So during our safety check, one of those things we're making sure we have plugged bar ends. Although that is not the only part of our bike that we can have a puncture type wound occur. So the brake lever is also a potential danger spot that for our participants. This isn't really necessary. There's not a ton we can do to mitigate this risk, except potentially, keep the brake levers only as tight as they need to be to stay in place while riding, so that if they fall, instead of staying super, super tight and firm where they are, and then causing a puncture, they will break away, move, get out of the way so that that's less likely to happen. I have only seen this type of injury once, and it was out at a pump track when I was out in West Virginia. One of the riders, he was a, I don't know, younger kid in the 10 to 12 age range. He had the brake lever puncture the inside of his thigh. And it was definitely a serious, like major incident that we did document and everything. So again, this falls in that pretty rare category, but it is something that we want to be aware of. Pretty common types of, or the other type of puncture that, I used to look at as like a welcome to the mountain bike world, has gotten less common with how bikes have changed. So, chain rings digging into the backs of calves, super common, especially like when we were all using 3x drivetrains or 2x drivetrains. The risk has gone down a little bit as we've been moving to 1x drivetrains because that chain kind of protects our leg from those teeth on the cog, but I always end up with a little bit of grease from my chain or lube from my chain, dirt, grit on the back of my leg at some point during the ride. But some participants may still be using that type of equipment, so it is something that we'll want to be able to dig into. And we could also see a puncture from a ground fall, maybe if there's like a stump or, a stick standing up in a weird way or some other kind of trash debris out on the trail. We may have some type of puncture associated with that, but not super likely in my experience. I haven't seen anything like that, but being able to clean and get that all taken care of will be super important. So when we're looking at some different types of wounds, we can look at lacerations, and we will go in depth on cleaning procedures, all that sort of stuff. Um, but when we are looking at lacerations, this is a little bit less common, I found, because there's not a ton of things that will straight up like cut us. That's the type of injury or wound that we're talking about is basically a cut. Um, I mean, I mentioned quickly that, taking a pedal to the shin, and if that pedal slides well on your shin, that could definitely lead to a laceration. There are some scars on my shins that would indicate the possibility of that happening. And we would still provide our medical care the same way, but it could be a little bit more severe than just like a basic puncture from a pedal. We may also get like major to minor scratches while riding, depending on the areas that we're riding in. When I was out running the program in West Virginia, we would, in the springtime, all of the trails would have just like briars hanging over, and you try to clear them out, whatever. It's hard, super hard to keep up with, and you would just get like dozens of little cuts in your elbows from having your elbows out, and the briars would just get like stuck in there, and they'd get itchy, and I'd have like mild allergic reactions, like they'd swell up. And that's still something that we'll want to be aware of. We'll still want to clean that in very similar ways to abrasions and punctures and what we'll talk about in a minute here. The only other way that I could think of to get a laceration outside of like, cutting yourself on a rock during a fall, that sort of thing, is from squeezing the brake levers. Like if our brake levers are too soft, and they can definitely dig into that second knuckle. I have definitely had that happen, and that's something that we can talk about during our bike safety check. So if we feel that we can squeeze that brake lever until it bumps into our knuckle or until it goes to the handlebar, perhaps it'd be worth it to move that brake lever out a little bit so that it engages sooner, and move it out still to the point where the participant can still reach that comfortably. But that might give us a little bit of a way to mitigate the risk associated with that particular problem. Abrasions are are one of the types of wounds that are pretty common. So in any type of crash, even if it's like a low impact crash, we could have just like a scrape across the elbow or a scrape across the knee. That sort of stuff definitely happens, and the best ways that we can mitigate that is clothing and protection, as well as making sure that we're getting our participants to ride within their level. And if we're practicing doing our skills clinics on grass, the likelihood of an abrasion is super, super low. But that risk goes up if we're forced to be on pavement, if we're forced to be on gravel. Those things can increase the risk, which is kind of bringing it back to another reason. Grass is soft, but it's also good to do skill development practice on grass because it's not going to cut us up. So the mitigation of all these, shin protection is a really good one. Pedals to the shin happen pretty frequently, uh, and keep riders within their limits. And when it comes to, most of the time with mountain biking protection, a lot of folks will put knee pads on first. That's what maybe they'll come to the clinic with. I've worked with some coaches who have required knee pads depending on the type of clinic that they were offering, which I think is not a bad idea at all. And one specifically that they did, and this is a coaching business out of Ottawa called Ride Ottawa. Awesome team of coaches. With their rear wheel lift clinics or their wheel lifting clinics, when they're getting the rear wheel off the ground outside of coaching jumping, they have their participants move their shin or their knee pads down to their shins. And sure, they're a little floppy. They're not like perfect knee pads, or they're not perfect shin guards, but they can still take a major edge off of that hard pedal to the shin if our feet aren't in the appropriate position for those moves. So really good risk management from that crew there, and I love that idea. So I wanted to share it with a lot of folks. When we are taking riders out on the trail, the best thing we can do to prevent these injuries is keep them within their limits. We push limits when we're in the cone zone, we push limits when we're progressing through the skills that they just learned. But out on the trail, especially like right off the bat, we want them to feel challenged, but we don't want them to step too far out of their limits because that's where we're likely to come into an incident. Things that are going to help with this, we're not going to go super in depth because I've definitely done a lot of talking about this in the past, but paperwork that goes along with all these incidents. So making sure that we have an emergency action plan that maybe gives us some steps of the first aid, it gives us people to inform. We have an incident report so that even if we can document what we see, and even if that participant says no to care, like especially the chain ring to the back of the leg, I have never had a participant say, yes, you can bandage this up while we've been out on the trail. They're all just like, nope, it's okay. So we need to have that refusal of care document to show that we at least tried to care for that participant. We may have a SOAP note, which is going to be that note that allows us to track our participants, over time, especially with more serious injuries. And then that's something that we can pass off to definitive medical care if our patient or participant does need to go to the hospital or anything like that. So moving into some treatment principles. Um, a lot of these treatment principles are going to come from the National Outdoor Leadership School, as well as some other research that I did online. Tons and tons of great resources out there for how to clean, how to assess, and how to bandage care. But go get one of those, do a in-person first aid course. I prefer the wilderness first aid courses because it is, especially like Knowles and Solo, those providers do so much like hands-on, let's make splints, let's use this, use gauze, let's like actually like bandage these wounds up throughout the course. So highly recommended. But throughout, depending on the provider, there's some big concepts for when we're stepping onto the scene. So number one, making sure that it is safe for me to approach the patient with whatever's happening around us. Two, what happened to you? I'm trying to just get some general impressions about what happened. I can start asking questions at this point, like, hey, what happened as you fell? Like, what hurts? All that. We can start getting into that. And then three, not on me. So that's when we're going to put our personal protective equipment, gloves, and a mask. And four, are there any more? Of course, just like checking to see, like, did this crash cause something else? Did they crash because of the person in front of them? Like, what's going on? Do I need to pay attention to anybody else? And five, the only way I know of this is with a rhyme, dead or alive, but that's our general impressions. How serious is this injury? How much blood is there? What steps am I going to need to take first? And of course, stopping the bleeding is going to be step number one. And maintaining that consistent pressure. And so even with our glove, maybe we start there holding onto the wound right at the skin because we will want to expose the wound. And then we will end up putting gauze, or some type of sterile padding, a combined pad maybe, onto that wound to absorb some of the blood that's around, as well as help to just like keep pressure on that wound. Again, most of the injuries and wounds that we're going to come across on the trail aren't likely to, and I'm going to knock on wood for everybody right now and for myself, but aren't likely to be big, huge, dramatic ones. In my experience, I found that incidents in mountain biking, there's a lot of low consequence incidents, things that will have some scabs, will have some bruises, but typically will recover pretty quickly. That seems to be the bulk of the types of injuries that we get in the mountain bike coaching world. But Still very, very important to, pay attention to the amount of blood that's coming out. And if needed, which I haven't run into this in a professional context, if needed, put pressure on the wound. And if that bandage fills with blood, slap another bandage on top and continue that pressure. That's going to be our best way to stop bleeding. There are a lot of products out there like there's like little powder things that you can it's like they're blood clotting agents. I'm not sure of any particular brands. Um and those can very, very effectively like stop bleeding fast. But what they so in an emergency, like, okay, I hear that. But what they don't allow you to do is clean the wound. If the amount of blood is a threat to life, like, stop that bleeding. That's our priority. Stop that bleeding. We can deal with problems with infection, that sort of stuff later. Um, but we want to be able to clean that wound. That will become very important, especially if we're doing like a 5-day backcountry guided trip where maybe we are a little ways away or a day or two away from definitive medical care. We want to be able to clean and maintain that wound. So increase pressure, get that bleeding to stop. Uh, Excellent. Once the bleeding has stopped, if we're able to release pressure, how we clean will kind of depend on the type of wound that we have. So, looking at our punctures, we are going to, depending on how deep or if whatever punctured is still in there, if the oh, I mean, so if the object is like, let's say the brake lever broke off in the patient's leg, we stopped bleeding around it, did not remove that lever. Um, if that's something that if we remove it, it's going to allow that blood to flow really aggressively, we're going to leave that in, bandage around it, stabilize that impaled object. Of course, if that impaled object is in any way impacting breathing, we will have to remove that. But again, that more serious type of puncture isn't as likely for us to happen. And I found even with like brake levers, like and most punctures in the mountain bike world, it's like kind of in and out. It doesn't like stay or get broken off in there from what I've seen. So clean it out with a bunch of water. Punctures are nice if it's a little bit deeper or bigger. And for all of these, we'll talk about the irrigation syringe. Unfortunately, my first aid kit is not in my house right now. But an irrigation syringe is a small syringe with a kind of like a jet end uh, exit. So when you squeeze it, it comes out just a very pretty narrow stream of water, but with a lot of pressure. And we can use that really, really precisely to get particles of dirt, little pieces of rock, whatever got into that wound or into that puncture out. And depending on the size of the puncture, right off the bat, of course, like as long as our bleeding is stopped, that's all good. For small punctures, we can put some, after cleaning with water, we could maybe use some antiseptic towels to kill any bacteria around it, and then put some bacitracin or some sort of antibiotic on there. And we could use a Band-Aid. I very often lean towards gauze and athletic tape because it's just super versatile. And it can be used in a ton of different contexts. So basically, like making a Band-Aid out of gauze and athletic tape is what I go for because athletic tape is just so strong. I highly recommend investing in the if we go with the Band-Aid route, I highly recommend investing in the uh, fabric-based bandages. They hold so much better. And especially with mountain biking where we're moving our entire body, even if we're walking out or riding out after this incident, we will want to be able to make sure that that bandage can stay on. But backing it up, whatever Band-Aid with some athletic tape is a good call too. If our puncture is large, we may need to ball up a little piece of gauze and kind of stuff that in there to pack the wound. That might be a necessary option, but it's really hard to say in the field. We did do that with the patient who had the brake lever go into his thigh because it was really, really big. And the other person responding was a nurse. in an emergency room. So she was like incredibly helpful and was like, "Yep, this is what we're gonna do, and this is what they'll do at the hospital," which was all good. So that may be something that could be helpful, but oftentimes bandage, clean and bandage as normal. When we are looking at lacerations, for example, these can, if it's just a straight cut, or, bunch of water, any water that's clean enough to drink, bunch of water to clean it off, and then irrigate out because there's likely some dirt particles in there with the irrigation syringe. We may need to start using, depending on, if there's like a little flap of skin hanging over, we'll want to irrigate under the skin flap and then flap it back down because that skin may still just like reconnect in the wound as it heals, which is nuts. But we might need another helpful tool in butterfly strips, which are the little white pieces they're sticky on two ends and they help bring wounds together temporarily. Having those cross on either side of the laceration can be really helpful. And then I still like to put gauze and bacitracin antibiotic stuff on top of that with however we want to close that wound up with tape or band-aids, whatever is going to work out for that situation. But those butterfly strips are very hard to replicate. So throw a couple in there. They're packs that are like this big and there's like 15 in there. Not something I've used a ton of times, but those have come out a couple of times while teaching. Excellent. And abrasions are probably some of the least enjoyable things to clean. I mean, when we get a scrape, it usually covers a really big surface area, especially compared to a puncture or like a small laceration. Covers a big surface area, so there's a lot of nerves being impacted, and we're going to use a ton of water to get it clean. And we may need to get to the point where we scrub that with some gauze. I'm just using my shoulder so you can see it in the video, but we may need to scrub that out, and we're going to do that. We're going to get it as clean as we can, as long as the participant will let us do that. As long as our patient's like, okay, yep, keep getting it clean. Because in our context, oftentimes we're in the front country. So, the trailhead is 3 miles away and it's paved and there's a hospital in that town, not super, super far. And they can do any additional cleaning that's necessary from there. Or maybe they'll just go home and take a shower and deal with the pain there. So we'll clean it as much as they let us, trying to get as much of that dirt and everything out. But abrasions can be tough, especially when, if we're coming down like loose on hard pack, kitty litter stuff like riding down in Arizona would be pretty rough to get all of those little tiny rocks out of a patch of abrasion. So we've talked about cleaning. We've talked about removing a bunch of debris. We may also just go to tweezers if we need to pull out little pieces of rock. They can be a little bit more precise than just a basic scrub. It'll maybe take a little bit longer, but our patient could feel a little bit more comfort with the tweezers, provided we're being delicate. Awesome. And if the participant, if this was a serious incident, of course, checking to see if there's any other problems going along with the injury than what we just see, just that wound. A really good question for us to ask is going to be, did you feel anything prior to the crash or prior to the incident? Because, you know, hot day hot day, lots of exercise, we're getting tired. Perhaps they were experiencing low blood sugar. They felt a little lightheaded that causes them to lose coordination. And that's what caused the crash and stuff like that. If we're not able to also address that, because then it could lead to another incident. When the participant crashes, they're going to have a lot of different things going on in their body, probably some adrenaline that is going to mask potentially the symptoms that they were experiencing leading up to it. But I found most of my crashes happen as a result of me not being 100% there physically. Like maybe I was tired, I was getting lazy out on the trail, and those are the sorts of things that usually led to it, or I like had already bonked and I'm feeling like uncoordinated, whatever. Like oftentimes that's what's going to lead me to crashing. And so if we're not asking our participants about those things, it can be uh it's hard to ensure that we're not going to have another incident occur before too long. Awesome. Again, just like big review of the concept or of the cleaning concepts. Expose the wound, ask a lot of questions, use a lot of water that's drinkable to clean out the wound, and bandage effectively enough to get us back to the trailhead or to get them to their car or whatever choices are going to be made from there. When we're looking at so post injury or post incident, the wound is bandaged, whatever style of wound it was, we're gonna see what it's like to get that participant moving and see what it's like to get them out of our clinic. And sorry, that sounded real rough. See what it takes to get them back to their car safely so that they can ride again. So if this is something that, it's a took a pedal to the shin. Those hurt for a little while for sure, but it's probably something that's usable as we move forward. And so we'll want to try, depending on our injury, think of some type of usability test. If it is the shin, it's impacts that are going to make that hurt and make that bruise, whatever, it make that patient feel more pain. And so, you could have them do some like calf raises or some heel raises on the ground and maybe let their heels come down and see how it feels. You could have them just pedal around on their bike if they're feeling up for it. And just monitor, just check in, see how they're feeling as they go. Usability tests also are impacted by how good of a job we did bandaging it. If we bandaged it up, let's say it's at a point like on the kneecap or on the side of the knee that is moving constantly while we're riding. If it's not bandaged up very well, it's probably going to come off, 150 yards of pedaling down the trail. And so that's something we want to be aware of too. And if it's not that serious of an injury, maybe that's okay. Not too big of a deal. But we do want to always try to prevent that from getting dirtier or from getting worse. So think about what is the injured part of the body and will that how will they be able to continue to use that as we're getting back to the trailhead. Let's also be sure to think about what do our participants want to do. Uh, After a crash, I always encourage people to get riding again slowly, same, do it soon, but slowly, start with easy stuff, do some circles, roll over some logs, whatever. I always participants encourage participants to do that, but sometimes that might not be where they are at. Uh, they may want to, maybe they were having a rough time in the clinic leading up to it, and they crashed. There's some, emotional insecurities going on. They may want to take off, and we can encourage that, and that's fine. If or we can encourage them to stay, whatever, but we can't force anyone to stay in our programs. What we can do, if they want to take off, if they feel ready to ride away, or if we are still in the field, um, sign them out of the clinic and then have them take the risk on their own. That is an option that we have. Of course, like if we're out in the middle of the trail on a trail system they've never ridden, I'm going to be a little bit more direct about the consequences of leaving the clinic at that time and maybe modify our route so that we can get that rider back faster and then maybe do some other stuff with the rest of the participants. Because what we definitely don't want to have a participant, even if they signed out of our program, we don't want to have that participant go and get lost at all. And most people are pretty reasonable when it comes to that. But if incidents occur near the parking lot, that participant may want to take off. And oftentimes they're capable enough to do that on their own for sure. One other factor is what other skills do we have, like about debating whether to, allow the participant to, or like dismiss the participant, or like kind of cut the clinic short. What do we have coming up on the trail or in our clinic? If we take a really, really big spill where we are injured, especially like on the shin, doing some rear wheel lifts in a clinic, and our goal is to work up to basic jumping, the fact that they got injured from a pedal come or foot coming off of a pedal, maybe that's an indicator that, like, hey, and this happens to everybody, it happens to me for sure, but maybe that's another indicator that, like, maybe we're not totally ready to get both wheels off the ground. And if that happened, or if our participant wants to keep it going, we can still like manage risk around it and like coach them to appropriate speed so that things aren't getting too crazy, or at least like keep a close eye on their progression. Um, but it can be tough to come back and push yourself in that way successfully immediately after an incident, especially somewhere that it's public in front of a group, all that sort of stuff. So those are kind of our big evacuation decisions. Is it usable? Are the participants ready to keep going? Are they still stoked about what we're doing? And what other features are coming up on the trail or coming up in our clinic? What are we working on? Those are kind of the evacuation choices. And again, most of the times, the wounds that we're dealing with, small lacerations, abrasions, some punctures here and there, are usually pretty minor, which is excellent. I love that. It's super, super great. And they become even more minor and less frequent if we're managing risk appropriately, which is the biggest thing. And I know a lot of us have a really, really good head for risk management because we're riders ourselves that don't want to get hurt. So we manage risk in our own riding. And that's like, we just need to bring that and coach that into our participants as well. Awesome. Well, this wraps up all the information that I thought we needed to talk about for wound care. So feel free to give me a holler if you guys have any questions. Travis@icp.bike is my email. And I hope that y'all have a great rest of the evening or whatever time of day you end up watching this. Have a good night. Bye.